morning, dear students. Today, I'm going to have a video-based lecture on one of the important topic in physiology. Um in physiology, I don't know whether this topic was covered in your regular classes. However, as a physiotherapist, uh, to orient yourself in the physiology subject, I would like to stress more on this topic because this topic has got more application in our practice. Okay, okay. The topic is going to be pain physiology. Okay, the pain physiology and pain gate theory. Okay, you can refer this topic anywhere in the web, in the physiology textbook, or any article that talks about pain. Okay. The pain physiology, it's a very elaborated, very large topic actually. I'm going to cover as simply as possible. Okay, as a just to introduce you to this concept. Okay, so please listen this lecture carefully. Okay, we all perceive pain. Pain is one of the important pathological signal that we have. Any diseased condition will cause pain. Okay, so, how the pain is perceived? First, we have to understand. The pain is always, because of some abnormality in the body structure. There may be some chemical irritation, or there could be some metabolic waste product accumulation over there. Uh, could be causing, could be actually stimulating the receptor, that receptor called nociceptive receptors. That means the pain conducting receptors. It will be there all through our body surface as well as into the various connective tissue structures. Okay, these receptors perceive this abnormality. There is some irritation, chemical irritation. uh, okay, so that is perceived and it conducts, and the signal, the information goes through the peripheral nerve. Peripheral nerve is like a wire. Okay, it goes to the spinal cord. Spinal cord is a bunch of wire. Okay, and in the spinal cord, especially at the posterior horn, it goes and from the spinal cord it goes to the brain stem, and from the brain stem it goes to the cerebral cortex. In the cerebral cortex the pain is perceived. Okay, so that is the wire. But this wire is not a continuous single wire. It is a part, it's a connection of various small wires. Okay, how many wires are there? If you see, where are the connections available? Let us see now. From the nociceptor, it goes to the spinal cord. There is a connection. There is a there is a connection there. There is a junction there. From there, from the spinal cord, a new wire starts, and it goes up to the brain stem. Okay, there is another junction there. Then again a new wire starts from the new nerve fiber starts from the brain stem, and then it goes to the cerebral cortex. So if you see, there are several junctions are available. Okay, these junctions are very important. These junctions are called synapses. Okay, the two nerve fibers or connecting junctions are called synapses. This is the synapses. This is the area where we have we can modulate the pain, we can reduce the pain by using these junctions. That is what is the important aspect here. The normal physiology is actually the pain is conducted through this. That's it. Now, how we are going to use the junction? Okay, before we look at the junction and how we can reduce the pain by using the some of the physiology in the synapses, let us see. Okay, what type of fiber is actually conducting the pain? I told you the pain is always perceived by the nociceptive receptors. Okay, and it takes to the spinal cord. It is not only the nociceptive receptors. Sometimes the large diameter fibers also sometimes receive and conduct the pain impulses. Okay, what are they? The two types of fibers are there. The nociceptive receptors are always called C fibers. They are very small diameter, and there is no myelin sheath for that. Myelin sheath is a covering around the nerve that will not be available for the C fiber. Okay. There's another type of nerve fibers, the receptors, which are called A delta fibers. The A delta fibers are large diameter, they are myelinated. They also conduct pain, but there is a small situational restriction for this. What is it? Only when there is pain impulses available, both these fibers will conduct the pain to the spinal cord. Suppose if there is a pain impulse, simultaneously, concurrently, there is other impulses like mechanical impulses or vibrative impulses or thermal impulses. Thermal means heat sensation. If they are available, these kind of mechanical, thermal, vibration kind of things will be conducted by the large diameter fiber, and the small diameter fiber will conduct only the pain impulses. Okay, both will go to the spinal cord. Now in the spinal cord, there is a magical thing will happen. What is it? Only when there is only 5 pain impulses are conducted in both the fibers, the small diameter and large diameter fibers, it will be allowed. The pain impulses will be allowed to go up, will be allowed to go up to the brainstem and then to the cerebral cortex, where the pain will be perceived. The patient will feel the pain. Okay. Suppose if both small diameter fiber, that is taking the pain impulses, and the large diameter A delta fibers also take the pain impulses to the spinal cord. The spinal cord, there is a place called substantia gelatinosa and nucleus proprius. Okay, I repeat again, substantia gelatinosa and nucleus proprius. There are 2 areas are there, which these 2 areas, they will suppress, they will not conduct, they will inhibit the pain impulses. That is, that the impulses which are coming through the small diameter fibers will be inhibited, and they will only conduct the impulses which are coming through the large diameter fiber. Those impulses are mechanical or thermal or vibration or cold, heat. This kind of information only will be going through. That will go to the brainstem and then also to the cerebral cortex. Okay. So what happens now? There is a gate in the spinal cord, in the place called substantia gelatinosa, that actually inhibits the pain impulses. Okay, that is why by using this natural physiology, we use techniques in physiotherapy to modulate, to relieve the pain for various pain conditions in the patients. Though the problem is still there, we still can modulate, we can still reduce the pain amount which is perceived by the patient. We use various modalities for this, okay, by using this natural pain physiology. And this process is called pain gate mechanism. We are using the pain gate mechanism, which is available at the spinal cord level, in the place called substantia gelatinosa and nucleus proprius. Okay, this is what is the pain gate mechanism theory. And okay, we use as a physiotherapist, you can just remember this. We use various physical modalities called transcutaneous electrical nerve stimulation and various massage therapy and transverse friction therapy, interferential therapy, IFT we call it. So all these modalities are used based upon this pain gate theory. Okay, so listen this lecture many times repeatedly and try to summarize them and send it to me in the Google Classroom. Okay, that is your a small task at the end. All of you summarize them and send it to me. Thank you very much. Have a good day.